Hi guys, thanks for joining me today. I'm just sitting here having a cup of coffee and relaxing. Just thinking back over this last week. It was the first week of the COVID reopening here in Florida, phase one, and that allowed you to have surgical procedures, elective surgical procedures done. And Monday then I went in and I did have a procedure done. And this video is not about the procedure and my health or anything. It's on, was it safe to go? And what do you feel about that? Okay, I'm going to walk you through just what my experience was at the surgical center. This I know it's only one location and everything, but this may give you an idea for those that are kind of worrying about, do I go ahead and do an elective surgery right now, or do I hold off? I don't know, this might kind of make you decide and help you decide one way or the other. So I'm just going to tell you what I experienced, and you can take it for whatever you believe, good, bad, and make your own decision. When we first pulled up, we were already aware that my husband Dan wasn't going to be able to be in the building during the procedure and everything. He was going to have to wait outside. So when we pulled up, what did kind of, I don't know, it kind of made it more real of the precautions they were taking. We saw a bunch of the road the cones that are set out, for barriers to stop traffic and things like that. Those cones were set out into the different parking spots, and there would be several with the cones, and then there'd be a parking spot that was open, and it would continue on. That way, anybody that was waiting for someone inside having a procedure, they were keeping the cars distanced apart. As I walked in the door, there was a gentleman there that took my temperature, rolled the thermometer thing across my forehead, took the temperature, asked my name, asked who came with me and their phone number. So COVID questions on whether you travel in the last 30 days around anyone that had tested positive, that kind of thing. And once past there, then he said, okay, you can go to the front desk and check in. The lady there gave me some paperwork to fill out. She was behind the sliding partition, and when she would talk to me, she would open it up, and then when we were done in between, she would close it. There was some hand sanitizer there if you wanted to use for the public. She also went through and asked the same questions as far as the COVID questions. And like I said, gave me some paperwork to fill out. I noticed there was one other person in the waiting room, and when I sat down to fill out my paperwork, that person was taken in fairly quickly. And I think they had it set up so that only two people would be in the waiting room, something like that, because they had along the walls and everything, they had all the chairs turned backwards, and then there would be a chair that you could actually sit in. And I don't remember there being very many options for someone to sit. And there was no coffee, that was gone. I'm trying to think of what else I noticed there. That probably was about it in the waiting room and everything. Once I was able to go back into the surgical procedure area, and pre-op area, I guess you would say, the nurses were great. They wore their gloves. They, after going ahead and taking my vital signs and everything, and taking blood pressure and things like that, I saw them removing and getting new gloves. They would wipe off the cuffs and stuff that they used on taking the blood pressure, and they just seemed like they were very cautious of keeping things sterile, and then of course making me comfortable. I'm trying to think, all the people that came through, you could see there was a button that they could push to walk into the other room towards the surgical procedure area, and everyone was using their elbow. Nobody was actually pushing that button with their hands. And I could hear water constantly running where it sounded like people were washing their hands. It just seemed like a constant on again, off again, continual thing within the building that I could hear. They kept, as far as the beds there when I was getting ready, there normally was room for 6 people to be there. They only had 3 beds available. It was every other spot that they used, and they also pulled the curtain in between you so that to help keep the barrier. Going back into, I want to say too, when I was back there, I heard some nurses talking about this was their very first day back with the phase one, that they had been off on, and they had to apply for unemployment because of being off of work with the COVID virus. And some of them were talking about that they spent 4 days, day and night, here in Florida trying to get their stuff filled out online to apply for unemployment. But they were all very happy to be back to work. And I think they had a great attitude, and I do think they took a lot of precautions. Going back into the procedure room, I'll be honest with you, I remember that there were probably 3 or 4 people back there. As soon as I was pushed back there on the cart and then transferred on to the bed where they would do the procedure, everything happened so fast. Everybody was just in total action mode. Somebody, was making sure I was positioned right. Somebody was putting the pads, I guess, so they could monitor all my vital signs on me, propping my neck up with the pillow, and I mean, just everything they needed to do. It was just like bang, 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 it was happening. I honestly couldn't tell you. I don't know if I noticed whether they had protection on their hands, whether they had the gloves on or not. That I honestly don't know. Like I said, it just happened so fast, and the next thing I know, then I was wide awake. Well, it seemed wide awake to me, and I was in the recovery. At that point, they were very... Oh, and one more thing. When I went into that room, they kept me the whole time with my mask on. So when I sat out in the waiting room, I had my mask on. When I went into the room prior to going into the procedure, they wanted me to keep my mask on. They rolled me into the procedure room with my mask on, and only when they were ready to put me to sleep a little bit, give me the anesthesia, did they told me that they were removing the mask at that point. They did so, and when I woke up in recovery, my mask was already on. They had already put that back on me. Trying to think, and along this whole time, everybody there had a mask on, from the person that checked me in, from the out, at the door, at the entrance, the front desk, and everybody back in the procedure room, and everything had a mask on. When I came out then and was starting to come through the recovery and wake up a little bit, that of course they asked if I needed anything and how much pain I was in and things like that. But then when I was ready to get dressed, they did help me get dressed, and once again they were very cautious on making sure that they had originally kept my clothes all in a package, and my wallet and things like that they had locked up, and it had my name on it, and there was a list of how many credit cards I had in there, if I had a phone, that type of thing, so that when I pulled it out, they went through it with me to make sure everything was there. I'm just trying to think of what else happened when I was in there, if there's anything else I could tell you. Like I said, a lot of this I think that they had as a regular procedure, and that was just be common sense for them to do in a surgical center to keep people safe. But there was those few things that it's pretty obvious that they were put in place because of the COVID virus. Now, whether you believe in the virus or not, I'm not disputing that or saying yes or no. What I'm doing here is just kind of letting you know that they are, at least this location was taking precautions and everything, and then maybe this will help you decide on whether you want to go ahead and get any procedure done that you're kind of debating on whether to go do that or not. I hope this information has helped. There are a couple things I wanted to go ahead and say that I totally forgot in the video here, so I'm going to go ahead and just add them on now. One was when I was in the waiting room, there was a couple that showed up, husband and wife, and immediately they asked who was having the procedure, and it was the husband. And then they wanted the wife's name and cell number and asked her to quickly exit the building, because no one other than the one having the procedure was allowed within the building. So, of course, she wanted to be in there with her husband, just like my husband wanted to be in there with me. But that time's changed right now, and that was not allowed. So she did go ahead and exit without any commotion or anything. Since the people that our loved ones and things and caretakers were sitting outside waiting in their vehicles. After the procedure, things were handled a little bit differently. Some doctors walked out and actually talked to them at their vehicles. My doctor actually called my husband, let him know that how the procedure went and that I was heading to recovery. Once I was in recovery and ready to go home, then the nurses called my husband and let him know that he could pull around and pick me up. So at no time was my husband in the building at all. I just wanted to go over, those are a few things that were different because of the COVID virus and some of the protections that they put in place. And I, once again, just want to thank you for your time for watching, and you make your decision on whether this was good, bad, whether you want to do a surgical procedure, elective surgical procedure or not, and just use your own best judgment. Thank you for watching.